As officials are working to encourage booster shots, people around the country are resisting vaccine mandates. In Dallas, Southwest Airlines employees gathered outside of the headquarters yesterday in opposition to the company rule. And some parents in California are resisting a vaccine requirement issued earlier by Gavin Newsom. All eligible students at public and private schools must receive their shots. Joining us now to break down the latest COVID headlines is Dr. Jeremy Faust. He's an emergency physician at Brigham and Women's Hospital in Boston. So, Dr. Faust, you live in Massachusetts, where a vaccine mandate just went into effect for state employees. Those who refuse face termination. What would you say to people who are foregoing inoculation?
Thanks for having me. The message that I would send to people is that we are living through a crisis in which more people have died since 1918. We really have a pathogen on our hands that can kill 750,000 people, basically, in this country, and that we aren't all the way through that yet. And so basically, when I hear about all of these protests and I see people who are worried, what I always remind myself of is that these are exceptions to the rules. Basically, most people are interested in doing this. People who have not been vaccinated, for the most part, there is still some hesitancy based on some of the concerns outlined, but a lot of it's logistics. So I do think that so many people want this vaccine and very few really resist it. Yes, those make headlines. Yes, those are areas of concern, but most people have questions and we're happy to answer them.
I think that's a really important point to reinforce at times. Sometimes it's the nature of media. Sometimes we can amplify voices because their voices are legitimate. They have concerns. But when you look at the numbers, more and more people are getting inoculated. More and more people are saying, well, you know, I'm fine with the mandate. I'll get the shot. I haven't gotten around to it yet, but I will do this. And now we're looking at the possibility of a booster shot. And the FDA is going to be considering whether or not to give the green light to mixing and matching booster shots. I want to encourage people to lean into the science. And so I ask you, what does the science say about this approach?
It's a great question. The science says that mixing and matching appears to work. That's the most important thing. And the main reason that I think that's important for the most part is convenience. We don't need people not getting a booster who need one because maybe one vaccine is in stock or not. So the fact that we can make this flexibility makes this decision a little bit easier for people who need that booster. Certainly for people who are older, 50, 60 plus, a booster is important in terms of keeping them out of the hospital. People with immune-compromised conditions, booster is important. And then for other age groups, there are certain risk factors that the CDC and the FDA are concerned about. But I think that we're seeing that the vaccines actually do hold up very, very well in terms of preventing severe disease. So they're doing great. I don't want people to think that the booster is a sign that the vaccine isn't actually performing well. And in fact, it is. So the science suggests that mixing and matching seems to work, and it raises those antibody levels, and we believe that correlates in most cases to a clinical outcome, which is better protection. We certainly know that's the case for Pfizer based on Israel data, and we assume it's the case for the Moderna and the Johnson & Johnson options.
Dr. Faust, let me ask you about this. The death of former Secretary of State Colin Powell has a lot of people focusing attention on so-called breakthrough COVID cases among people with compromised immune systems. General Powell, who was fully vaccinated, died yesterday of complications from COVID-19, as you know. The 84-year-old was also being treated for a rare blood cancer known as multiple myeloma. When we see vaccinated people dying from COVID-19, when they have these underlying health conditions, I guess my question is twofold. What are we to make of that, of someone who is infected with COVID-19 after being fully vaccinated and has what are serious underlying medical conditions? And two, what's the message to people who are not vaccinated, who may come into contact with people with immune-compromised systems?
Yeah, it's a really important question. The first thing is that we know that for people with genuinely severe immune-compromised conditions, including multiple myeloma, but also other conditions, that for the mRNA vaccines, 2 doses is not quite adequate. A third dose is part of the initial series, if you will. I almost think of 3 doses for immune-compromised people as not a booster, but the third dose is just the completion of the series. So that's been really well documented in the medical literature, that the antibody levels and the protection that 2 doses gives people with immune-compromised conditions just isn't quite enough. So that's number one. We have to get the people who are the least protected from 2 doses, the most protection possible. Breakthrough cases are unfortunately expected. These vaccines work so well that it makes headlines when they don't work. That's how I would frame this. And unfortunately, there are enough people who are well known and respected that when this happens, it'll certainly get our attention. But what I would say to people who are maybe looking at this moment with concern is that getting vaccinated protects people like Colin Powell, who didn't have enough protection because of a medical condition that they might have. And so it's our job to, as a community, protect each other. So this vaccine is not just about protecting yourself, it's also about protecting those around you. And I think that's what this moment really underscores, because we see that, again, these vaccines work extremely well, but they're not perfect. So we really have to rely on each other to be a safety net.
Just to point out to our audience who may be wondering, General Powell was scheduled to actually receive his booster shot, which makes this all the more tragic. He was going to get that booster shot when he fell seriously ill and thus was unable to get it. So I just wanted to put that out there.
Yeah, no, it's really important. We know where the priority groups are. We know that in the Israel data sets, they did a lot of boosting, and they really got ahead of this. And we see that, at least in the short term, that boosters for people who are older really had an impact in decreasing infections. It decreases infections across the board, but in terms of severe illness, it absolutely decreases severe illness for older populations as well. We don't know how long that protection lasts, but quite frankly, with a disease like this, it makes a lot of sense, because there are very few problems associated with vaccinating that would really negate that benefit for older folks. So yes, I have very much seen these data, and I think that for immune-compromised people and for older people, it's absolutely really should be considered a near necessity. And then for younger people, I think it's really it's a question of risks and benefits. And I do think that the younger you go, the less likely it is to benefit you personally, and the more likely it is to benefit those around you.
Yeah, Dr. Anna-Marie, I'm glad that we're talking about this, because, it's easy if you are not plugged into the media ecosystem. You've got a job that you work, you've got kids to take care of or family members, you got a lot going on in your life, and you may just see the headline. The headline says, former Secretary of State Colin Powell succumbs to COVID-19 complications, right? And you don't realize that he did have, in fact, a very, very serious blood condition, a blood cancer, which ultimately played a part in his death. You may think to yourself, well, you see, the vaccines don't work, because here he was fully vaccinated and he died of complications from COVID-19. So I'm so glad that we're able to break that down and explain why the vaccines still work, and why they do work, and why people should get vaccinated, for those who are not vaccinated, and those who are should receive their booster shots. Because I think it's easy to get caught up if you're just not paying attention to, then all of a sudden you're talking to somebody else and you say, well, I saw on the news that Secretary Powell died of complications from COVID-19 and he was fully vaccinated, so that means the vaccines don't work. They in fact do work.
That's correct. The vaccines have performed so well. And I think that, as you say, it's headlines when they don't work well or when they don't fully protect somebody. I think that both sides of this question are going to package it the way they want to see it. I feel very firmly and very strongly that the science supports exactly what you just said, which is that vaccinating provides the best protection possible. Someone's going to say, oh, look, even so, it doesn't work. But we also know that that's true of any medical intervention. We know, for example, that if you have a skin infection or pneumonia from a bacteria, that we give you antibiotics. And if the antibiotics didn't quite work, we would give you more or a different antibiotic until it works. That's not quite the same situation where you can't just keep vaccinating over and over again. But the idea is, we are certainly familiar with the idea that for some people, you need more of a good thing. So that's a very typical kind of thing. We also know that seatbelts are not 100% effective. We know that seatbelts decrease injuries, decrease deaths by orders of magnitude, really, or many, many times more than without. So just because, unfortunately, we still have automobile deaths in this country doesn't mean that airbags and seatbelts aren't doing their job. But in fact, the better they do at that, the more common, the more likely it is that we see it as a tragedy, because we see it as preventable. And that's really the message, that we have turned SARS-CoV-2, this virus that causes COVID-19, we've turned it mostly into a preventable illness, or an illness that should be preventable in terms of causing severe disease and death. And the vaccine is so good that we take pause in those moments when we realize that it's not a complete shield. It's not a absolute force field.
I like that. It's kind of like the man bites dog headline versus dog bites man, or it's like this is out of the ordinary when there is a failure to this level, because it's working so well. Dr. Jerry Faust, thank you very much.
Thanks for having me.